Hello, and welcome once again to a series of Mind Series, another episode. Tonight we'll be presenting some information regarding autism spectrum disorders. I'm here today with Carrina Lindblom, licensed educational psychologist, and together we'll be trying to present a way of recognizing kids with autism for people to understand more about the diagnosis and how it might look in an individual. So first I'd like to back up, just present a basic idea of what we're talking about. When we talk about an autism spectrum disorder, you're talking about three potential disorders. One's called autism, which means you have all of the criteria for diagnosing a kid with autism. The second one is called Asperger's syndrome, which is really like autism without a speech problem. And then there's something called pervasive developmental disorder, which is a diagnosis which doesn't contain enough of the other segments to make a diagnosis, but still abnormal enough to make a diagnosis. So those are the three basic things, and they're considered a spectrum because they can vary from individual to individual, and sometimes being more severe in one area than another. Autism's been identified for about 60 years. Two different individuals originally identified it, and they really talked about a child or a person being within themselves, that they weren't interacting with their environment, which still holds true, but there's still some variations as far as that goes from the theme. As far as the prevalence, there's about 4 to 1 boys to girls, so there's more boys who have autism than girls. And currently in the United States, it's approximately 1 out of 150 kids who have autism, which has been a striking increase over the past 20 years. Since 1987, apparently, there's been a 634% increase in the number of kids identified with autism. There's some debate as to why that's happening, that in some cases, certainly kids are being identified with autism that may not have been identified previously. But I think there's also truly an increase in incidence of the disorder, which raises a question of why is it increasing in our world? And that's an area of hot debate and a lot of discussion, and hopefully continued research to find out why that might be. A child with autism is usually identifiable early prior to age 2. 75% of kids prior to age 2 have signs and symptoms of autism, but usually it's in hindsight that you recognize those things. Sometimes people will bring in videotapes or DVDs of their children prior to age 2, and then in hindsight they'll look at it and they say, gosh, now I see it. But if it's a first-time parent, or actually almost any parent, you can look at some of the behaviors and think, well, that's something they're going to grow out of. It's not severe. It's just a behavioral thing. He's a late talker. There's a lot of reasons why you might assume that it's not autism. And in fact, if you take a child in to see a physician, oftentimes with specific concerns like that, they may dismiss it as just being a late bloomer or late development in certain things. So when signs or symptoms of autism are seen early, there's certainly something to be taken seriously and at least be screened for effectively to make sure it's not autism, because we know that early intervention is very effective. Some of the things you see early on in children is they don't have any babbling or talking prior to age 12 months, which means they should be saying single words, not in sentences or anything like that, but single words by that time. They should be saying small phrases by age 24 months, by 2 years of age, and they should have the ability to interact with somebody. There's something called joint attention, which means if you are with a child and you want them to look at something with you, they will follow your vision and where you're pointing over to a place where you mutually will be looking at something. If you're talking about a tree over there and you go turn to look at that, does the child turn to look with you? Do they notice you and do they engage with you normally? Do they laugh responsively with you? So those are some of the kind of things you see early on in a child. As the child gets older, the things start looking different. And that kind of takes us into the 3 pieces of autism. We'll be talking about all 3. The first one is called impairment of social relationships. And to talk more about that and kind of give you a flavor of what it looks like, I'll turn that over to Carrina and have her kind of explain that for you.
So in a child with autism, oftentimes they're having a difficult time forming relationships with others. This can manifest early on when they're having difficulty forming a meaningful relationship even with a sibling. So for example, at home it might look like the child is off on their own all the time, playing with specific toys, not really able to enter into play with a sibling. Unless it's a topic of interest for them, in which case their sibling would then play with them with that toy or that activity that they find preferable. At school, oftentimes parents will come in and describe that their child isn't interacting at recess. So oftentimes what I'll hear is they're reading a book or they're walking around the perimeter of the playground, picking up things and playing with them. In the classroom, they're not engaging in classroom discussions. They're more withdrawn, and oftentimes teachers will say they appear to kind of be in their own world. So in terms of social interaction, that's typically what we see in terms of autism and Asperger's syndrome.
And to give it a kind of a picture of that, a lot of times a teacher or parent, if their child plays alone, will explain it away by saying he likes to play alone. And typically for a kid, that's just not the case. I mean, maybe when they get older, they may elect to do that. But for a child to really want to play alone or to be so engaged in what they're interested in, to not let other kids in to join in, really makes that distinction. And also, as you talk about them engaging with other people, you can see them not approaching other people, knowing how to engage with them socially. And can you tell us more about what a social perspective is like, that ability?
So social perspective taking, when somebody has a delay in that, it's hard for them to be able to understand that other people in their world have thoughts and feelings that aren't the same as their thoughts and feelings. So in the research, they talk about theory of mind, and you might hear that come up. And it's just the idea that I don't understand that other people have thoughts and feelings about me. And in that situation, it can be hard for a child to identify how their behavior is impacting the people around them, because they're not stopping to think about what are they thinking about my behavior. So with perspective taking, that can be really difficult for these kids, and something that we like to teach them.
And there's a lot of social rules that aren't written rules. There's a lot of things that you do mostly because you know them innately. So just like nodding your head right now when you do that, that's acknowledging that you understand, that you agree with what I'm saying, and that's a way that you do it, not because somebody told you, oh, you need to nod your head every time you agree with somebody. It's because you mimic, you understand that, and you do it without thinking about it. Children with autism don't have that ability. And some of the social rules you look at when they have that is you say, well, is it okay to do some things when you're talking to somebody? Right now I'm looking into the camera, that's probably appropriate to do. But if I were to turn this way and keep talking, I guess I could still give you the information, but it might be kind of weird if I did it this way. But have you ever seen it in a rule book anywhere that said that I had to look into the camera to talk all the time, or can I continue to do it this way and not really show an expression to the camera? Is that okay? Well, of course not, but how do you teach a child that? Well, you don't ever, when's the last time a parent teaching a normal child said, you need to look at people when you're talking to them? Well, that doesn't happen very often because it's innate. You know to pay attention to somebody when they're speaking by looking at them. So look at the camera if you're talking to the camera, because I'm talking to somebody in that invisible box there. So that's what you have to do, but nobody has to teach me to do that. So it's very hard for kids with autism to know how to do that. So you really have to develop a way to work at a very basic level to help them understand that. And that's called that perspective taking. How do people appear to me? An example being a young man when he went down to Marine World, and he goes down there and everybody lines up around the aquarium then. And then the guy that comes out to talk, he goes out and stands in front of them. And everybody kind of naturally creates this little nice half circle around him, whereas a child with autism walks up and stands directly in front of him. Now, is there anywhere that says don't cross this line? You're not allowed to stand next to this person who's talking? Heck, that's the best place to be. And for an autistic child, why not? Everybody else looks at him and says, you can't be doing that. That's not okay. When in fact, there is no law, there is no rule. So those are the unwritten rules that they really struggle with.
Something else that comes to mind is oftentimes parents, think, well, I'm modeling for them. They should just pick it up because I do it. And a child with autism isn't going to learn by just copying their parent. They oftentimes don't copy a parent. So I think that sometimes when parents come in and they hear that, well, your child's not going to be able to learn just because of watching you. You're going to have to teach them exactly what you want them to do.
And some of the behaviors that we as parents love to do, like eye contact. I remember doing this with our son. I can't tell you how many parents I've come in with an autistic child have done this. To look at somebody when they're speaking, especially if it's a parent, and especially if it's a parent who's trying to get you to do something. And then if you don't do it, it's because you're not listening. And so what you expect from your child as a matter of respect is, John, I want you to go clean your room. And John's not looking at you. He doesn't do it. He doesn't acknowledge you because socially he doesn't know that he needs to acknowledge you. So he continues to look to the side. So then you raise your voice. You raise it even higher. You get to the point where you say, John, go clean your room. And then he finally says, why are you yelling at me? Well, it's because you're not paying attention to me. You're not showing respect that you need to be showing me. So frequently parents will take their child's face and they'll go like this, and they'll say, look at me. And the child will be looking at them like this, and they have no idea why they're looking at you. Why do you look at somebody? I mean, you think about it, it's innate. Again, you're reading their face. You're getting, I think, 80% of communication besides verbal is from looking at someone's face. That's how you find their expression. And if a child doesn't know to read the expression, then they just look at the zit right in the middle of your forehead, and they look at it for 2 minutes and they go, okay, that was fun. Why did I do that? So a lot of kids with autism are trained to look at people, but they have no idea why. And I know that's something you work with.
Yeah. I just thought of one more thing that I want to share. Oftentimes a parent will come to me and say, well, my child is very social. He runs up to people on the playground and wants to talk and wants to engage and play. But what I find is oftentimes their child is wanting to talk about what their interests are. So they're what we call downloading information about their area of interest, for example, maybe dinosaurs or bridges or Pokemon or something like that. So they are motivated socially because they want to share everything they know about this topic. It's not this back and forth of sharing information for mutual enjoyment. So that seems to come up a lot also.
An example of that, I had a mother come in with a DVD of her son who was at preschool, and she was hiding behind a tree taking a picture, and the son was next to the fence, and a little girl came up to play with them, and they're both about 4 years old. The little girl kind of comes up and tries to engage him, and he turned to her and then pointed up to a roof vent on the preschool and wanted to talk about roof vents. And he actually knows a lot about roof vents, a lot more than I ever knew about roof vents. And it's kind of fun to think, gosh, my kid really knows a lot about vacuum cleaners or roof vents or something like that. But when you try to turn on another 4-year-old into this exciting topic, they're going to lose them in maybe 10 seconds when they talk about roof vents. Yeah. So a child like that doesn't know that's not interesting to anybody, and they don't pay attention to the fact that the other person's lost interest. And they can continue to talk about vacuum cleaners. Even after you've left the room, they'll continue to talk, not noting that somebody's not there. And it looks really different when that happens. Another thing is impairment in social communication. I mentioned that with what's called full spectrum autism, or some forms of PDD, NOS it's called, which means they have a speech delay, which is probably one of the more common reasons children come in early on suspected of having autism. Because if they're not talking by age 2, they're not using sentences, then it's what's wrong? Do they have a hearing problem? Do they have autism? Is there something wrong with their speech center? So what's going on with that? So oftentimes they have a delay in speech. I mean, they may eventually get speech, but it's not normal as far as how fast it develops. Sometimes there's a different way that it sounds. A child may develop speech, but language, which is the ability to use speech in a way to communicate something that's important, oftentimes they'll use them in kind of very awkward ways. They'll use awkward words or use a combination of words that don't make a lot of sense to the listener, or repeat things over and over again. Sometimes they have their own language. Well, they'll identify something as a binky, and it means milk, and they'll continue to use their own language. One of the most peculiar things is usually the tone that they use in their voice. They have especially kids with Asperger's syndrome, they have kind of this little professor voice. Well, they'll talk with this kind of this expressionless voice, and they'll continue to use the same voice in the same kind of a monotone without using any expression in the monotone to let you know it's interesting. Or they'll not know how to modulate their voice. They're in church. They talk really loud. Well, that's not okay. But who says there's a rule that you can't talk loud in church? It's not a rule. So they don't know when to adjust their voice to their environment. Another one is sometimes with children with autism, I just lost it. I just blanked. I have a speech problem. Maybe I'm autistic. It could be. I never know. Help me out. What was I going to say? Speech. What was I going to say? I think I lost it. So we'll go on. So impairment in imaginative thought. Now I get to hand off to you because I'm messed up.
So oftentimes, well, all the time, kids with autism or Asperger's syndrome have certain behaviors that aren't typical of kids their age. And so lack of imaginative play would be one of those things that we would look for. A parent will come in to us and say, well, my child can imagine things, and he's always Spider-Man, and so what I ask them is, well, if somebody else were playing house at school and they were in the kitchen preparing a meal, would your child be able to go in and enter into that play and start preparing a pretend meal with a friend? No, he would want to be playing Spider-Man over in the loft section. So that's what we're looking for, is are they able to enter into imaginative play with peers that would be typical of their age? Another type of behavior that we'll see often is a real intense interest in one topic or one activity. And every kid has interests. My daughter had a strong interest in Thomas the Train for a really long time as a preschooler, but this is above and beyond what a typical child would be doing in terms of an interest in Thomas the Train. It would be that they would only want to talk about Thomas the Train, and everything in their environment would have to do with Thomas the Train, and if someone didn't want to talk about Thomas the Train, they would still want to be talking about Thomas the Train and wouldn't want to talk about anything else. And so it's a really intense interest. Another thing that we see in kids with autism or people with autism is a real rigid system in terms of living their life. So they have to stick to a certain schedule. When there's changes in their schedule, it's very difficult for them to make that transition. At school, if they have speech therapy at 11:15 and their speech therapist is gone for the day sick, that could cause a major meltdown. If they drive the same way to work every day and one day there's a detour, that could really set them off. So just, having a really specific routine or schedule or some kind of ritual that is just really specific to them and not typical of others their age. Something else that we see is the typical person with autism is often seen in movies as someone that rocks back and forth or does a lot of hand flapping or makes repetitive noises so that they can hear something over and over again. So oftentimes we'll see those kinds of behaviors in children who have autism.
Examples of that, of course, they call them self-stim behaviors when they do that. And sometimes when they're excited, sometimes it's when they feel like they need to be soothed for themselves. And the hand flapping is something where they're looking at it like that. So it's not just a repetitive movement, it's a repetitive movement that doesn't make any sense. It's not appropriate to what's going on in the environment. If they like looking at a wheel spinning. I have one young lady who likes to turn a bicycle upside down, then spin the wheel, and then just keep spinning the wheel. It's not in an attempt to learn how the wheel moves or to learn more about the bicycle. It's just to continually stimulate her mind with the movement of the wheel. And oftentimes kids like that will do the same type of repetitive movement over and over and over again. So it becomes, you can identify, you can say, oh, I can see he's self-stimming over there. So self-stimulation kind of an activity. The other thing to recognize it as a parent, when a child gets stuck, I call it getting stuck, and they have a belief about the way something should be, they tend to be very rigid about it. And it's very black and white. They don't see gray zones very well. So if you say, we're going to go to dinner at 6 o'clock and it's 6:02, and they throw a fit, you as a parent say, get over it. It's 6:02. When I said 6 o'clock, as a parent, what I really meant was somewhere around 6 o'clock is the vicinity of it. For the rest of it, most of us, we all know that. We all know when parents say a little while, that could be next week. But for a child with autism, oftentimes, they're very rigid in that belief. And when you violate that, it's almost like a moral affront to them. It's very, very upsetting for them, and it's very difficult to calm them down, to help them understand that, well, 6:02 is close to 6:01, which is close to 6 o'clock, and help transition them into that. By the same token, they can become very fixated on doing something that's stimulating to them, and then to move them from one activity to another, it can be very upsetting. And again, as a parent, it's hard to respond to appropriately, because you say, okay, I want you to put away your Pokemon cards and let's go to dinner. The child is very fixated on the Pokemon cards, and he cannot let go. He can't stop until his mind says this is a good place to stop. So then you say, well, he's not listening to me. He's being disobedient. He's being defiant. And me as a parent, I have to say, you can't be defiant. You're being disrespectful. I, as a father, I have to say, you can't do that. That's being insubordinate. And so then you try to force the child away from that activity, and it creates this exaggerated reaction, which then the parent says, okay, they're overreacting, they're spoiled, they're something. But the reaction is so intense and can go on so long in a way which really is no advantage to the kid. If a child's manipulating you as a parent, usually you can kind of see what the end game is. They really want this, and if they throw a tantrum, they might get that. For a child with autism, when they're going through a meltdown like that, you don't see where there's any end game. There's no point to it. They're not gaining anything by doing it. And that's what makes it very perplexing when it happens. A couple of the other physical things that sometimes you see with children with autism, there's one called sensory integration disorder or dysfunction, which means they can be very sensitive to some things in their environment. For example, touch, taste, smell, visual things. Sometimes a certain sound, like a vacuum cleaner or a siren or a telephone ringing, something like that, can set them off. They're very, very sensitive to the sound. The flip side is that sometimes they can be very insensitive to it. Some kids can fall down, scrape their knee, and not even seem to notice. They can get blood draws, they can do all kinds of things, and they look at it with fascination, but they don't seem to sense pain like they would normally. When I think of kids who have a sense of smell or taste or texture, sometimes they're very limited in foods they want, because there's a certain food that isn't the way they expect it to be. It's the wrong texture, it's the wrong flavor. And again, as a parent, you say, just eat your food. Get over it. I mean, we've had applesauce before. This one looks different than the last one, but, what's the difference with cinnamon? I don't care. But a child with autism, no way. They look at that thing and they say, I have nothing to do with that. So again, sometimes you have to kind of ease them away from that and recognize what it is they're struggling with. When it comes to making a diagnosis of autism, then there's specific criteria, things we want to looking for. Can you help us with that?
Sure. So the most important thing is that it is causing some kind of impairment for this person. It's affecting them socially, or it's affecting them academically, vocationally. So that's first and foremost is when we look at all this criteria, social impairment, all these behaviors, communication, those kinds of things are impaired, but to what extent? How severe are they? And so oftentimes what we'll do is we'll look at each of the behaviors that they're displaying and we'll say, okay, well, how frequent is it? How often is it happening? And how severe is it? We have several kids that will come in with several of these criteria, but it's not really impacting them significantly. Maybe they do have an intense interest in something, and maybe they are doing a little bit of rocking, when they're feeling really nervous. But it has to be impacting them in some significant way to be able to make that diagnosis.
And I think one of the main things, friendships, I think, seems like it's one of the most difficult or most impairing things for kids with autism. They will oftentimes identify a friend, and then you ask them who their friend is, they'll give you a name. And sometimes the parents will say, I don't know anything about that kid. Because when you ask the kid about their friend, well, what do you do together? Well, they don't really do anything. They may identify the kid may have been nice to them and said hi, but that other kid would never identify the child with autism as a friend. And one of the clues you always get is, has he been invited to a birthday party? Has he been asked to come over to their house? When they play together, do they actually do things together? Or is it something where the child with autism drifts off and does his own thing? Does he know how to bring the other friend in? And if that carries on through life, then you continue to have these problems with relationships where you never really can be able to develop a friendship in an adequate way. So relationships are impaired. And many kids with autism would like to have friends, and they don't know why it doesn't work the way they're doing it. And that's why it's so important to identify that early and try to give them clues. Okay, when you do this, this happens, it's not going to work, and that's why it's not really a friend. And that's one of the things also when they're being teased by other kids. They don't know it, they don't understand it. They're so black and white with the way they interpret things that sometimes if you say to somebody, I'm going to break your arm, now the facial expression, that would tell you he's not serious, he's not really going to break your arm, whereas I'm going to break your arm. Now if a child with autism, he may take both of those things very similarly. And in fact, I had a child that recently was in middle school, and he hit another kid because of a threat like that the child with autism thought was real. And it was said in jest, and so I was called by the school to say that this young man was a bully, where in fact he wasn't a bully. He misinterpreted this thing. He really thought this kid was coming after him. So he was protecting himself, so he hit him. I bet it surprised the kid who was teasing him, but that would be why it's autism and not normal behavior. Now, when we talk about specific criteria, I know that we use different scales. Can you briefly touch on that?
Sure. So when a family comes to the clinic, first what we'll do is schedule an appointment with Dr. Thompson or myself, and we'll fill out a rating scale that looks at specific behaviors and if they're present and to what extent. After we do that screening with the rating scale and interview, then we'll use a more standardized measure using best practices, and we'll look at how the child is able to interact with the examiner. Are they able to engage in play? Are they able to understand other people's thoughts and feelings, that kind of thing. So that's typically what we'll do.
Okay. Well, hopefully you have a better idea of what autism is about, and in the next episode we'll be talking about things you can do to work with and treat a child with autism. So please join us for the next episode. Thanks for watching.
Good night.